talk about tofu, as in soybean, since you mentioned it as one of the sources of protein, and we've discussed it in detail. But the notion is also that it is a genetically modified, product, and there is a lot of glyphosate residue that stays behind it. So overconsumption, and also with hormonal issues like PCOS, though there is phytoestrogens present, I understand, but then there is a concept of avoiding too much soybean in hormonal issues, and also from the perspective of genetically modified bean. So what would be your take on that?
Yes, that's a good question. And genetically modified foods, we don't always know which ones are and which ones are not. That also we don't always know. But soybean certainly has been associated, even if it's not genetically modified, with the phytochemicals which have a weak estrogenic effect, which means they could be undesirable, particularly in hormonal disorders, or they may be behind some of the, say, increase in the prevalence of things like polycystic ovarian disease. So yes, certainly, I mean, in those situations, it may be desirable to avoid such things. But then again, soybean is only one of the foods which has such a phytochemical. There are several other foods which also have phytochemicals with a weak estrogenic effect. So ultimately, and again, comes down to lifestyle as a whole, which means that diet is only one of those factors. Take care of the others. And particularly when it comes to the mind, as we saw in Dr. Bhaswati Bhattacharya's session the other day, that if you have a sattvic tendency, maybe with some of the irregularities, which may be because of ignorance, or which may be because of the compulsions of modern life, or because you get only GMO foods without even knowing that you're taking some GMO foods, genetically modified foods. So because of all these things, there will be many mistakes, but then you may be able to get away with them to quite some extent if otherwise one has a sattvic tendency. You eat with the right attitude.